Hi everyone, we're coming to you from our new office in Carmel at MK Dermatology, and we wanted to talk to you a little about melanoma since May is Melanoma Awareness Month. And I'm Melanie Kingsley, board certified dermatologist.
And Mercedes Castellanos, I'm a physician assistant.
And we thought it was important to talk to you a little about your skin and the importance of sun protection, skin exams, seeing your dermatologist regularly, and things to look for.
Exactly.
So number one is know your skin, know your family history. Always watch your skin, be protecting your skin. I always say wear SPF 30 or higher.
At least 30, exactly, yeah.
SPF clothing, hats, really prevent sunburns, that's key.
That's the key. Like she was saying, melanoma, it's the bad skin cancer when we think about skin cancers. And it's really important to look at your skin every month. We practice the ABCDE of melanoma. And I'm going to explain a little bit more what that is. So A stands for asymmetry. So when you're looking at a mole, just kind of do an imaginary line and divide your mole and see if both sides are symmetrical or asymmetrical. B stands for border. So look at the border of the mole, see if there's any streaking or any pigment that looks abnormal. C is for color. So if your mole is getting darker, that's concerning. D stands for diameter. So if it's getting bigger, it's typically bigger than a pencil eraser, that's what they say. So always keep monitoring that. And E stands for evolving. That means if your mole is developing symptoms. So sometimes they can feel itchy, they can start crusting, they can bleed. So all of those are important things to look for. And we recommend every month to look at your own skin. Just kind of glance from your head all the way to the back of your toes or to your toes and look at your skin. And if you notice that any of your moles are changing, definitely let us know because that's concerning.
Yes, and I always say once a year, see your dermatologist for a full skin exam, even if you don't have any risk factors, because you just never know. Maybe you're used to a mole being there or you're not noticing one on your back. So commonly on the back of the legs, that's where we do find them, as people don't notice anything new or changing. So you and your partner, you and your family, just someone share self-skin exams, I always say once a month, as Mercedes was just saying, and then report anything concerning. You'd rather be safe than sorry. People always ask me what type of sunscreen, what SPF do I recommend, and I always say 30 or higher, because 30 blocks about 97% of the sun rays, whereas 15 is down around 93%. So you want to be up to that 97 or above. Look for zinc, titanium. I like the physical blockers. And I always say reapply every 2 hours when you're out in the sun for a long period of time, because the sun will break down the sunscreen over that time. What other tips do you give your patients?
Yes, another really important tip is that skin cancer can happen to anybody. And it could be any skin color, so everybody can get skin cancer, so that's why it's very important to look at your skin every month. And if you notice that any of your moles are changing, just let us know immediately.
Yep, so watch out all throughout the year. Even if it's not in May, always be aware of your skin, anything changing, and make sure you do your skin checks and see your dermatologist.